Can you say a little bit more about how you see burnout and suicide or risk of suicide as being related, at least for physicians?
Yeah, I think it's a good question. I think it's a tricky question. I'm not sure that because we know burnout and depression are a bit different, right? And so I think even in the field, there's a lot of questions about how those two might be linked. Certainly, we know that if you have a significant level of burnout, you're not getting rest, you're not attending to your basic needs, and that continues to happen over time, which really, I mean, again, if we just look at the field of medicine in general, that gets trained into you. We know that med students, for example,
Mhm.
are predominantly better than average when they come in as far as mental health. And I think within the first 2 years of training, like it already decreases. They come out of med school worse than average and then go into residency, which, it's like people barely have time to eat and sleep. And so, and really, I think people also don't know how little medical residents get paid. So there's a lot of stressors. They have these financial stressors, they have work stressors. And that's just training. That's not even going into your regular job. So, the accumulation of these things over time and then putting in any kind of life stressors where a piece might fall out of someone's life or might not be in someone's lives, like maybe they don't have enough support system and they're handling this burden of burnout over a long period of time, or they have a relationship that ends because of the work that they're doing or stress that they're feeling. Then I think those are the pieces where depression and suicide can then very sort of easily come in because there wasn't a strong. I always think of it like how full is your cup, right? Like if you have a cup that's a little more full, you have a buffer. But if you're always just functioning like at the survival level, essentially, it's a lot harder to have a buffer when other things start to go wrong.
Yes. Yeah, I'm laughing because I'm so identifying with this. So I feel like for myself, I started to experience burnout probably 8 years ago at this point. And I think that that really put me at risk of developing postpartum depression and anxiety when I had my daughter almost 4 years ago. And I didn't make that connection. And in my delusional state prior to having a child, I was like, "Oh, this is gonna be so amazing. I'm gonna get 4 months off. I'm gonna like, I'm gonna sleep. I'm gonna be able to take care of myself. I'm gonna walk every day." All these beautiful things that come with having an infant. And obviously, that was not the reality. And so I found myself progressively more and more depressed and anxious over the course of that first year. And things really didn't resolve until I started getting sleep because my kids started getting sleep. But that was almost a year later. And, in the darkest moments, I never thought specifically of suicide, but I started to be in that position where I was like, is this even worth it? Can I make it? What, like, I don't know if I'm going to be able to like function as a mom or as a clinician again. And I did, but I did have to get a lot of supports on board and come to that acknowledgement of this is something that I need help with that I can't do solo without community. So I imagine that a lot of other people have similar stories where maybe their burnout is manageable and then something happens in their life and it just pushes them over the edge of what they're able to tell.
Yeah, yeah, and we can think about COVID like that. That could have been one of those things. It's like they're already burnout, 40% of the population of physicians, and then you add in a pandemic, and not having PPE and all the other life stressors everyone else faced too of, not having childcare, schools being open and closed, life being and it's still less predictable. Things are harder to find. Patients perhaps now are more acute than they used to be. So it's like the ripple effect that continued after the pandemic for physicians as well. So yeah, I think you're right. And having a culture of everyone pretending that it's okay, that they can get through. And I also think, you mentioned sleep, and sleep is such, we know actually when we look at suicide, people that are in significant pain or not sleeping or have, again, these big relationship changes, those can be some of the factors. But sleep deprivation is so common in physicians, both by depending on what specialty they choose. But again, in residency, we can see this very often. So yeah, it's just another contributing factor of just not being able to take care of one's own basic needs.